Her doctor basically said, whatever that healer is doing that you have, keep doing that. The doctor was a skeptic at first and was kind of like, oh, I don't know about this. But finally, the doctor has said, you're doing nothing. In fact, she doesn't have the best diet. She doesn't have the best lifestyle, but she is getting healing so regularly. And it's been almost 5 years now. And the doctor said, you will probably die of something unrelated at this point, because the labs were so good. All of her labs had balanced out, and the filtration rate, or the GFR rate, had gone significantly up. So that is one of the reasons why I want to talk about kidney disease in general, is because the things that I've seen when I've done pranic healing for people with this are shocking. They're shocking for me, they're shocking for the client, and they're shocking for their doctors.
Namaste, everyone. Welcome to the Pranic Healing podcast. And on this episode, we're going to talk about a very special condition that you've probably heard of. And conventional medicine usually has a challenge in addressing it. But today, we're going to talk about sort of the pranic healing protocols, tools, and experiences from a very seasoned pranic healer, and how we can use pranic healing to address this condition. So my guest speaker today is Nathan Llera. Nathan has over 10 years of experience in pranic healing. Nathan is also a pranic healing instructor. And today, Nathan's going to talk to us about the conditions related to the kidneys and how we can use the tools and techniques that we are taught in pranic healing to really help these patients, help these clients get better. So please welcome Nathan.
Thank you, Dr. Jason. This is a pleasure to be here. I'm happy to, spread a little bit of the information about pranic healing. So thank you for having me.
Absolutely, Nathan. And as we were just talking about it, we met over a year ago at the lovely San Diego conference with AIHM, which is a conference for, healthcare and different medical professionals in more of the integrative medicine space. And I love the topic that we're going to talk about today because, chronic kidney disease and kidney failure affects so many people. And you've really had a lot of success, it sounds like, in working with them. And before we kind of get into that, I really want the audience to kind of get a little background about you, Nathan, because I know you've been doing this work for a while and you are on the West Coast there. So can you just give us a little short background and how you kind of got started in all this?
Of course. So, in about 2009, I had a rollover car accident. And afterwards, I started seeing a counselor because I was having some post-traumatic stress from the car accident. Not driving necessarily, but being driven. So my introduction to pranic healing was through mental health. And so there was a group in San Diego area that did pranic healing, and they were focused on mental health. And so the person that I was seeing for therapy, she introduced me to pranic healing, and I took the class, and it was a class full of medical doctors and medical practitioners. So I was the only one that wasn't. I was in school at the time for psychology, doing, I think, my associate's degree. And I remember having the person that I was paired up with had the flu. And of course, this is way before any pandemic stuff. You still showed up when you were completely sick, So I remember working on her in the Pranic Healing Level 1 workshop, which I now facilitate. You go step by step. You work on one thing at a time. You do one technique at a time, the 7 steps of pranic healing. And then you are doing a full healing protocol. So by the end of, as each step went by, this lady that I was partnered with had one symptom go away. And of course, at this time, I'm a skeptic a little bit. I'm just thinking, I'll try this class. It seems interesting. I respect the person who introduced me to it. And then I saw results in the first day. It's a 2-day workshop, Saturday and Sunday. So I came back on the second day, and I remember my teacher told me that I should teach pranic healing. So I decided to take all of the classes here on the West Coast and some on the East Coast too. And I just fell in love with it. And, that's one of my favorite things about pranic healing is that story, because I was able to produce a result Number one being a skeptic, and number two being brand new and practicing it for the first time. So this is definitely something that's close to my heart. I do it every day. It's a part of my lifestyle. It becomes more than just a healing that you do when someone's sick or when you're sick or you have a sick pet. It becomes a part of your daily lifestyle, and it becomes a part of preventative healing for me. So, and for other people. So, I think that is the best background that I could give you, because I come from just a normal background, and pranic healing has just become a big part of my life. And I'm, happy to talk more about it and teach people how to do it themselves.
Yeah, well, I think your experience, Nathan, is so many other people's experience as well in terms of like you said, being a skeptic and also being a beginner at it. And it just sounds like you got amazing, miraculous results on the first day, on the first try. And I think that gives credit to the amazing system that we have in pranic healing, because I was the same, but like you, I had like, oh wow, this is actually working, and I thought I was a little out of it, right, believing that this can actually work so fast and so easily, which it does. And I think that what you bring up is such an amazing experience, because I think that for so many of us, especially in the healthcare field, that's something we want to bring. We want to bring this as another pillar of a healthcare approach, because we know how amazing it is. And if we can just get through that, barrier that medicine has in general with its skepticism, I think that we can really make a lot of positive changes in that area. But speaking of positive changes, today we're going to talk about chronic kidney disease, and specifically with people with kidney failure as well, which is more late stage. But this is such a really important topic, as we know, Nathan, because so many people deal with it and there's not a lot of options. So can you help us understand what actually is kidney disease, and why is it so challenging for conventional medicine to address and support?
Absolutely. And, Dr. Jason, I'm sure you could explain it better than I can. So I'll give the layman's explanation of it, because I think that is what I can speak to best. So the kidneys, they clean your blood. So I think everyone can understand the importance of our blood, but maybe we don't realize that we have a system that cleans the blood. And imagine, if you didn't clean your car or your floor or something like that for long enough, it would become a problem, right? So, um, kidney failure, kidney disease is, you know, it's it's extremely common. You see dialysis centers all over the place, because when a person's kidneys cannot clean the blood anymore or function properly, then medicine has to do it for them. That's what dialysis is. And it's not in no way a treatment,
Right,
unfortunately.
right. It's more of a
So
like just a something that is temporary, but it's not a permanent solution.
exactly. And so there's some, there's a couple types of kidney failure, of course, and I've worked with all of them now, but kidney failure it's difficult because there's dialysis or there's a kidney transplant. So if you have acute kidney failure, or you had an injury that affected the kidneys, it can be reversed if it's caught on time. But if you do a quick search, like I did, you'll find that something like 90% of kidney failure is caught when it's too late.
Hmm.
So if it can be caught early enough, then it can be reversed, or mostly reversed without, too much damage. Unfortunately, that's not the case. So the only way that you would be able to identify it is to have regular blood and urine tests.
Right,
So for the people who do, that's fantastic. But a lot of people don't do it or don't use medicine until they're sick. So
right,
it's something that medicine lacks, but it's also not something that medicine lacks, because it's not that there's just an overabundance of kidneys out there for us to transplant. Somebody has to donate a kidney, or someone passed and was a kid, they have to match the blood, they have to match the tissue as well to do an organ transplant. And then even if you are able to get a transplant, there's the possibility that your body will reject the organ. And then you're on anti-rejection medications as well, so that that doesn't happen. So there's a lot of obstacles, and I'm not going to blame medicine for falling short, because it's just one of those things that we aren't 3D printing kidneys yet, which would be great. But
Yeah.
until then, there's some things that are obstructing people from getting the care that they need. So that's what ends up happening for me as a practitioner of pranic healing. Is I'm the worst case scenario person. People come to me when they're desperate, when they've exhausted every other option.
Yeah.
So a lot of times that's what I see, is people that come to me and they're like, please help with this. So hopefully that answers your question a little bit more.
Yeah, definitely. Yeah, thank you for giving us that background. And, I think it paints a very clear picture of just how challenging it is once you get to that stage of kidney disease is, it's hard. There's not a lot of options. But what we're talking about today is being able to use chronic healing, as you said, preventative, hopefully before the kidney, disease has started. But in your experience as well, Nathan, you've had some case studies and your own experiences working with these types of patients, and you've had success. So can you help us understand what is the chronic healing approach to kidney disease or just disease in general? Because I think that would help the audience understand, okay, not only does this work well for kidney disease, this also works for other things. Can you kind of give us that overview?
Of course. So pranic healing has two fundamental principles that doesn't matter what you're working on, who you're working with. These are the principles that make pranic healing work, which is the law of life energy. That's why it's called pranic healing. It's called prana, chi in Chinese medicine, ki like Reiki or Aikido. But really, the essence of what that is the life force or the fuel that keeps your body healing itself. In medicine, there's the term homeostasis. Your body is trying to find a balance. It's trying to heal always. So pranic healing is working with the body by increasing the life force, increasing the amount of prana that's in the body. The second principle is the law of self-recovery, again, that your body knows how to heal itself. So when you put these two together, you have the body knows how to heal, but the reason it doesn't heal as fast from the pranic healing perspective is that there's not enough fuel. So just like your car, you would fill your car up with fuel and then it would work as expected. Same as the body. We basically use certain techniques, breathing methods, visualization techniques, and we have a series of classes that you can go through, as I have for over 10 years now, like you said, to fuel the body with prana. And it's done with the hands. And there's a lot of ways that we get prana. But just to make it simple, it's everywhere. It's all around us. So that's why breathing techniques help in pretty much every area of medicine. They are talking about breathing now, doing specific breathing techniques, belly breathing or abdominal breathing, because with the breath comes life force or energy, prana. So by giving the body the fuel that it needs, it heals itself faster. That's the best answer that I can give you on it. And that's what we do with kidney failure. In fact, with kidney failure, it's very much an energizing or giving energy, certain techniques that we use over and over and over again to achieve the desired result. So it's exciting, because the first time I ever worked on this, I thought this is the most complicated thing I've ever worked with, but I had
Yeah.
immediate results with it, just like I did in the class.
Yeah. Wow. That's a really good way of describing it, because yes, in more of like, mainstream medicine, kidney disease is it is very complicated, because like you mentioned, when you're filtering so many things in and out of the blood, it's, there's a lot involved. And what it sounds like with chronic healing is that it's so universal. Not only does it work on neck pain or back pain very well, but even to something as complicated as kidney disease. So you mentioned a little bit, Nathan, that it's mostly a energizing sort of driven technique. So can you help us understand from, maybe diving deep in a little bit, to like, let's say the pranic healing protocols or principles. You mentioned, the different laws of life force energy and the law of self recovery. When you work on a patient with this condition, what are you actually feeling? What are you sensing? What's your assessment, and how does that inform your practice? Because a lot of people, especially when they look at energy healing, it's like, oh, there's not really a order to it. You guys just kind of feel and just send energy where it needs. But with pranic healing, it's more of a science, so there's more of a breakdown to it. So can you help us understand what's your process like?
Sure. So at the beginning of a pranic healing session, typically healers will sensitize their hands through certain techniques. Rubbing your hands. I think in Chinese medicine, they say the qi follows the shui, right? The blood. So
Yeah.
you get the blood going, you get the qi going, right? Or the prana. The first thing that we do is we sensitize our hands and we feel the energy centers, the organs, right? And you'll have an idea. If you look at some of the videos, my teacher, of course, is one of my teachers is Master Ko. And there's a really popular video on YouTube that's been up for a long time on Master Ko doing a demonstration on back pain. And he says he has the crowd feel somebody's spine or somebody's back and says, do you feel like it's even and smooth or there's some form of irregularity? Those are the words that he uses. So that's my approach when I do a pranic healing session. I'm feeling, okay, does it feel even and smooth? And with kidney failure, it feels like a gap. It's what we call depleted. So in almost every situation that I've had with the kidneys, working with kidneys, it's a depletion or there's lack of prana in the area that's preventing them from working. Now, of course, we're never saying that this is the reason. There are energetic and physical reasons for it as well. Somebody could have certain lifestyle or habits that are contributing to it. High blood pressure is one of the big contributors to kidney disease. But in pranic healing, we do it. It's just, is the area, does it have too much congested or is it depleted? And with kidney failure, it's almost always super depleted.
And anyone can learn to feel and scan for this energy, it sounds like, too.
Yeah. I mean, I always like to tell people, if you've ever been sitting in traffic, like I have to go through LA traffic every once in a while. If you're ever sitting in traffic and you just have a sense and then you look over and someone was looking at you, right? I think all of us have had that experience where you look over and someone's looking at you and then they look away really quick, but you could feel it or you could there was a sense to it. That's more of what we're talking about when we're feeling energy, is this very subtle sense. Now, people have it in different ways. Some people have a mental sense or like a psychic sense. That's not how I am. I don't have that. Mine is feeling with the hands, the way that I was taught in the class.
Right.
So everybody in pranic healing can learn to feel energy. Sometimes
Okay.
you have to practice. Sometimes you have to work at it a little bit to feel it. And for some people, it comes very natural. People that it comes natural to are like massage therapists, hairdressers, people that work with their hands a lot will tend to be very sensitive to the energy already. But I typically use the scanning techniques that are taught in the level 1 class.
Okay. So it sounds like with this scanning technique, you're feeling for these irregularities, and most of the time the energy is very low, very deficient. So, and like you mentioned, there was kind of the two principles in pranic healing. So, with chronic kidney disease in this condition, what do you do next? Like, what after you find this out? Do you just treat everyone different? Do you do the same protocol? What's the approach?
In general, pranic healing is a recipe format. So if you go and you open up a pranic healing book, you can go on Amazon and buy a pranic healing book. I mean, it's very accessible. It's not hidden. So you open up think about when you're cooking in the kitchen. I used to cook more, but but you open up the recipe book and it says, 1 cup of flour, a pinch of salt, 1 egg, right? And you put it all together and you follow the instructions and you get the end result, the cake or whatever it is that you're making, right? So in pranic healing, that's the same format, because that's something that, just like a recipe, anybody can do and anybody can replicate. So in pranic healing, we have kidney regeneration, which is a protocol, but we also have a series of different types of regeneration techniques for different areas of the body. So of course, everybody has a different situation and people also have, other problems as well, other ailments. But in general, when we're working with kidney failure, we're applying the regeneration protocols from specifically the level 2 class advanced pranic healing, which
Mm.
it's very simple, very easy to do. And you actually might be surprised how well it works for so many different things. I'm doing it right now. I'm doing it every day for different things. So, but it works very well for kidney regeneration. And I can also share some of the experiences that I've had with that. But that is the main technique that we're using, is a regenerative type of protocol or recipe.
Okay. Right. And that's what I find so important, because in science and medicine, you want everything to be standardized, right? Dosing in terms of treatments, and not a lot of other energy healing modalities can say that. And I find, again, pranic healing, like you said, it's like a recipe. If you can follow the instructions, whether you're a beginner or not, if you follow the instructions, you will get the cake at the end. You will get something, at least at the end. So, and speaking of that result, it sounds like you have a couple of experiences you want to share. So, can you help us understand what that looks like when you put it all together?
Sure. So when I was in the instructor's track, basically to learn how to teach pranic healing, just like anything, if you want to become a certified pranic healer, you have to go through a program. If you want to become an instructor, you have to go through a program as well. So I was teaching a 2-hour introduction to pranic healing before I was certified to teach. And in this 2-hour introduction, we had about 10 people. And I'm very new, but I'm confident at this time in pranic healing because I've seen it work. And I know nothing about the kidneys, and I know nothing at this time about kidney failure. And in this introduction, this bright, happy woman showed up. She looked amazing. I was like, wow, she looks so fantastic, and she was very vibrant, radiating, and I had done the healing, and I did a demonstration on someone random that had back pain, and she wasn't able to get off of the seat because her back pain was hurting. And then after I did the healing techniques, specifically the energizing part, she was able to get up, and she actually did like a little dance, and everyone in the room was giggling and laughing and having a good time. And then we got into more of a conversation because it was a smaller, intimate class. And the woman who was very vibrant said, I'm here, in the Southern California area where I teach. She's like, I'm here. I'm from Northern California, but I'm here because I'm trying to get a kidney transplant from my brother. And they had a blood match, but they were waiting for a tissue match. At the same time, she's getting dialysis every day. So at the time, her GFR, which is the filtration rate of the kidneys, and basically it comes out to a percentage. The kidneys are functioning at this percentage. For her, it was 2% kidney functioning. I went back and looked at my notes from the past. So she didn't have very much money or anything. And we had weekly pranic healing clinics, pranic healing samples that you could come and get a healing. So I did that. But then I also offered to do healings, and I did a series of 12 healings. And I'll get to that, of course. But then at the same time, when the lady came up and said, my kidneys are functioning at 2%, another lady in the class, her just jaw dropped. She said, I'm here because my husband is going through, chronic kidney disease and end stage kidney failure. So I was super surprised. Two people in the same room at the same time were there for the same reason almost. So anyway, back to the first person. I never saw the other lady again, but the very vibrant one, she said, yes, I'm open to distant healing. I'm open to anything, right? At this point, she has to be. So I did one healing, and the next Wednesday, I had the same event. The next Wednesday, she came back, and she was, jumping for joy. She gave me a card and she was super, super happy. And she said that, because she's on dialysis and getting all the labs done, making it simple, her doctor was shocked because her kidneys were functioning at 12%. So I was like, okay. So when I went home, I started looking it up. Do the kidneys fluctuate, or the rate? Do they fluctuate? And maybe a little bit, but not that much, was what I got from my quick search. And I've looked this up a lot because I've questioned myself, is this just something that normally happens, or is this something that's unique to pranic healing? But it is something that dialysis doesn't really make the kidneys jump up very high in a percentage. It just kind of keeps you at base level. So I did a series of 11 more healings for her, and then her kidneys were functioning at 36% at the end of those 12 healing sessions. I think even her doctor had said she had gone backwards a stage in the prognosis. So we were super happy, and that's a long story, and I won't go into kind of what happened with that. But then in the more recent years, I've had more people come to me, and when I hear about kidney failure, I'm like, hey, here's something interesting that happened with this pranic healing thing that I do. And so I met somebody who I actually admire very much. She's a long-term client of mine. I work on her many times a week, and she chose, number one, she can't have a kidney transplant. She has renal tubular acidosis, I think. It's the kidney wouldn't be able to attach. And then she watched a family member go through dialysis and decided that she would never do that. So, I felt for her, and she reached out to me. A friend of mine was doing healing for her, and then he got injured, and she was referred to me. And now we've become great friends over the years. She's very sassy, and she argues with her doctors a lot, and I'm always just kind of, I don't support that, of course, because I always want everybody to do what their doctor tells them to do. But over the years, in the essence of what has happened with the situation is she went from being in the end stage, kidney disease, where she was looking at a very short life expectancy, to the reason I say she's sassy with her doctors because she has a joking relationship with her nephrologist, her kidney doctor. And her doctor basically said, whatever that healer is doing that you have, keep doing that. The doctor was a skeptic at first and was kind of like, oh, I don't know about this. But finally, the doctor has said, you're doing nothing. In fact, she doesn't have the best diet. She doesn't have the best lifestyle, but she is getting healing so regularly and we're doing the healing so much. It's been almost 5 years now. And the doctor said two things: keep doing the healing, keep with that healer, because whatever I'm doing isn't changing. Whatever you're doing isn't, keeping you going. And number two said, you will probably die of something unrelated at this point, because the labs were so good. All of her labs had balanced out, and the filtration rate, or the GFR rate, had gone significantly. So that is one of the reasons why I want to talk about kidney disease in general, is because the things that I've seen when I've done pranic healing for people with this are shocking. They're shocking for me, they're shocking for the client, and they're shocking for their doctors. I mean, I end up getting calls from doctors like, what are you doing with my patient? Thinking that I'm doing some stem cell or some experimental thing. And then I tell them, oh, it's energy healing, and we're, cleansing, energizing. It's a regenerative technique. And they're like, oh, okay. They don't have much to say after that.
Right.
But the results have been shocking and overwhelming.
Yeah. Yeah, they're like energy healing, pranic healing. Oh yeah, that's normal. Okay, as long as it's not stem cell or you're doing some crazy underground operations, putting a 3D printed kidney in them. That's incredible. I go back to what you say, Nathan. You'll probably die of something else other than what you're referring to, the kidney disease, which is crazy, right? The labs all come out normal. And like you said, she doesn't have the best diet or lifestyle. And this is really the only thing that you're doing basically different. And I think that speaks volumes to, the miracles of health. And when you understand and you use it in a system like pranic healing. So, I mean, as a healer, what's your take? Because now it seems like it's kind of the normal now, but I know it sounded like you were kind of skeptical at first. Like what's your take of all this?
I will always appreciate when I have a student that's skeptical over a student that takes everything you say hook, line, and sinker. Because I was a skeptic, and I identify with that attitude, and I want my students to be skeptical. So it's part of the curriculum in pranic healing, actually. It's intelligent evaluation. You have to not listen to what I say, and if you respect me, or you respect pranic healing, or you love it, you think it's great, you believe it, that's great. But I still always will encourage my students, and I do this myself, to continue to experiment on it. So if somebody says, oh, I felt so much better after that, if they had back pain, neck pain, something like that. Say, okay, but did you put anything on it? Did you take a pill? Did you do something else? So I'm always drilling to see, was it pranic healing that worked? Because I don't want to be under the impression that it's working when it's actually something else that's working for it. So I appreciate the skeptic. I appreciate the person who wants to do analysis and wants to try it maybe like even 5 or 6 times before they make a conclusion. So our teacher, Grandmaster Chokakusui, the founder of Pranic Healing, he said in all of his books and all of his classes, you have to come to your own conclusions. And that is my biggest takeaway of it. Still to this day, as convinced as I am that people could heal through pranic healing, I still will always keep a skeptical mind, even though I'm like, okay, they've had constipation for, years because they're on this medication. You applied the constipation protocol yesterday and they went to the bathroom for the first time in a week. That's not normal. Right? That's not very common. So my takeaway is, always to keep your mental faculty strong, not to just believe it because I said it or because someone you respected said it. Try it, practice it, and then come to your own conclusion about it. And then if you have questions, ask, because that's what we're all here for.
Yeah, and that's one thing again, I appreciate about pranic healing is that it really allows you to think for yourself and gives you the freedom to make mistakes or follow the instructions and get results. And, there's no really any mistakes. But I think what you're saying is that the protocols, they're there because it's proven. It's been done before. Same thing in science, same thing in recipes and cooking. So I think what you bring up is just another amazing way of how, again, pranic healing. These people are coming to you because they're not the worst cases, but they've tried everything and nothing works. And to see success in all the experience that you're describing, Nathan, it's pretty inspiring, to be honest. It's like, yeah, if I was their doctor, I'm like, what is this guy really doing? Is he really not giving them something else special? But as we know, yeah, energy healing, pranic healing, it's a gift in its own. So to really close out this conversation, Nathan, I know we talked about pranic healing and how you've come so far in your journey, starting with mental health and now having sort of a really great handle on these difficult cases and kidney disease. If you were to ask yourself, and this is the last question I ask all my guests, if you were to go back to your 10-year-old self, what is one piece of advice you would give them? And then also fast forward 10 years into the future, what's one piece of advice you would like to give our future generation 10 years down the road?
I think I'll give you one answer for both. And it would be what I would tell myself if I were looking at myself, or even if I were looking at a family member, or like my nephew or something. I would say, keep going. Just always keep moving forward. Even if you're only taking a small step forward, or even if you take a step back, that's okay. But just keep moving forward. Just, anytime something comes up for you that feels like it's stopping you from moving forward, you have to overcome. You have to keep moving forward. So you can quote me on that in 10 years if I'm ever struggling, and just bring me back to this, because that's what I would want told to me. And that's what I would tell other people too, is just keep moving on.
Yeah, well said, Nathan. Short, sweet, and to the point, especially like Master Ko too. Master Ko is one of those healers that reminds me of what you're saying. Just keep moving forward. He's like a giant bulldozer.
Yeah.
So I can see where you take on inspiration. Well, thank you so much, Nathan, for this conversation. It's been really just amazing just to hear about your journey and working with these clients and patients and the sort of miraculous results that you've gotten from. It's really incredible to see. For all those who are interested in reaching out to Nathan for more support or questions, I will leave all of Nathan's contact information down below. And for those out there in Southern California, I know that's where Nathan resides, but he also does distance healing. So I'm sure he can help you with all your needs related to pranic healing there. Well, that's all for the podcast, Nathan. Thank you so much for coming on. Is there any last parting words you want to give us or to the audience?
I think that's we've said it all. I mean, there's so much more that can be talked about, and I'm sure Pranic Healing podcast will evolve into something cool. So I hope this was helpful in that service that you're providing, and for everybody who's interested in trying Pranic Healing or taking a step in the direction of learning, reach out to Dr. Jason or to myself, or do a search for pranic healers in your area. You'll be pleasantly surprised, I'm sure.
Yes, we are very nice people, and usually we give you more than you ask for, and it's not through us; it's through the connection and through the teachings, and meeting great people like you, Nathan. I'm sure it's always a blessing to have. So thank you so much, Nathan, for this conversation. I really enjoyed it myself. Again, if you've enjoyed this podcast, please leave a like and rating down below. And if you want to support us, you can subscribe. That's all for today, everyone. Atma Namaste. I hope you all take care and see you in the next episode.